Hello and welcome. I'm Amritpal Singh. You're watching a special broadcast hashtag tracking COVID-19 on DD India, your one-stop destination for all information related to COVID-19. And it goes without saying that we at DD India are taking particular care to give you, the viewer, accurate, authentic and authoritative information so that you don't fall prey to rumors or fake news. Trust me, wherever you are in the world, you might be, it is in your interest to follow the advisories of the government, the protocols and guidelines issued by the authorities concerned. So stay at home, maintain social distancing, use masks and gloves and wash your hands regularly with soap. That is the most important. Maintain hand hygiene. Let's get started. First up, the headlines we are tracking at this hour. Prime Minister Narendra Modi interacts with parliamentary floor leaders of political parties via video conferencing, says priority is to save each and every life, says the situation is akin to a social emergency. It has necessitated tough decisions and the nation must continue to remain vigilant. Prime Minister Narendra Modi praises the efforts of the state governments working together with the centre in the fight against the pandemic, says states, district administrations and experts have suggested extension of lockdown to contain spread of the virus. Prime Minister Narendra Modi says Arogya Setu is an important step in fight against COVID-19, urges all to download it as its effectiveness will increase with more usage. Active corona positive cases hours in the country go up to 4,643, while corona related deaths stand at 149. More than 401 persons discharged after recovering. State governments taking quick steps to contain COVID-19. UP government decides to seal hotspots of 15 districts of Uttar Pradesh, including Noida and Ghaziabad, till the 15th of April. Madhya Pradesh government invokes asthma with immediate effect to tackle the coronavirus spread. Maharashtra continues to be the biggest hotspot of the country with COVID-19 spread, with total number of active cases going past 1,048 fatalities. Chief Minister Uddhav Thackeray asked former Army Health Services personnel, retired nurses, ward boys to join the war against coronavirus. And the fight against corona continues across the world. US registers the highest single-day corona-related deaths with 1,800 casualties. 757 lives lost for the second consecutive day in Spain. China lifts 76-day-long lockdown from Wuhan. British Prime Minister Boris Johnson still in ICU, but his condition has stabilized. Well, the big news of the day is coming in from Uttar Pradesh with number of coronavirus cases rising to 343 in the state. Uttar Pradesh government has decided to seal the affected areas in 15 districts across the state that have high viral load of COVID-19. The state government has said that only home delivery and medical teams will be allowed there.
आगरा में 22 ऐसे हॉटस्पॉट्स मिले हैं 12 थानों में, जिन पर कार्रवाई की आवश्यकता है। गाजियाबाद में 13 ऐसे हॉटस्पॉट्स मिले हैं 7 थानों में। गौतम बुद्ध नगर में 12 ऐसे हॉटस्पॉट्स मिले हैं 12 थानों में। कानपुर नगर में 12 ऐसे हॉटस्पॉट्स मिले हैं 10 थानों में। वाराणसी में 4 ऐसे हॉटस्पॉट्स मिले हैं 4 थानों में। शामली में 3 ऐसे हॉटस्पॉट्स मिले हैं 3 थानों में। मेरठ में 7 ऐसे हॉटस्पॉट्स हैं जो 8 थानों में मिले हैं, उनमें कुछ ग्रामीण थाने भी हैं। बरेली में केवल 1 हॉटस्पॉट है, वो एक ही थाने में है। बुलंदशहर में 3 हॉटस्पॉट है, 3 थानों में है। बस्ती में 3 हॉटस्पॉट है, 2 थानों में है। फिरोजाबाद में 3 हॉटस्पॉट है, 1 थाने में है। सहारनपुर में 4 हॉटस्पॉट है, 4 थानों में है। महाराजगंज में 4 हॉटस्पॉट है, 2 थानों में है। सीतापुर में केवल 1 हॉटस्पॉट है, 1 थाने में है। और लखनऊ में 8 बड़े हॉटस्पॉट्स हैं, 4 छोटे हॉटस्पॉट्स हैं, 11 थानों में है। इन 15 जिलों के इन हॉटस्पॉट्स के अंतर्गत जो थाने हैं वहां पर जो है विशेष रूप से हमें जन सहयोग लेकर 100% जो है लॉकडाउन का पालन करना पड़ेगा। जो थोड़ी बहुत भी रियायत थी वो रियायत नहीं रहेगी।
So if you're living in these areas in these 15 districts of Uttar Pradesh where these hotspots are, your local administration will be informing you about it. Do not go out. Do not go out. It's a complete sealing. Your essential items will be delivered to you at home. Your local administration will be informing you about it. The idea is do not go because community spreading can take place in these hotspots. They have been completely sealed. Please follow these instructions because once this spreads, everybody could be affected. So these 15 districts, these hotspots have been declared. Your local administration will be getting to you. Do not panic. Just stay in your homes. Your essential items like food, etc. will be delivered to you. Medical supplies will be there. In case a person is affected or shows symptoms of being affected, medical teams will come to your home. So do not venture out at all if you are living in these hotspots in the 15 districts of Uttar Pradesh, which you just heard the Additional Chief Secretary speak about. And the Uttar Pradesh DGP, H.C. Awasthi, has said that there will be an intensive sanitation drive in the hotspots and strict action will be taken against the lockdown violators.
जो अभियोग पंजीकृत हुए हैं वायोलेशन में लॉकडाउन के, उनकी संख्या रही है अब तक 11,461। इसमें जो अभियुक्तों की संख्या है वो 37,082 और जो एसेंशियल कमोडिटीज के तहत मुकदमे दर्ज किए गए हैं उनकी संख्या है 269 और जिन लोगों के खिलाफ दर्ज किए गए हैं उनकी संख्या है 349। तमाम सारी गाड़ियां निकल रही हैं जिनको लॉकडाउन के दौरान नहीं निकलना चाहिए था, उनके विरुद्ध जो प्रवर्तन की कार्रवाई की गई है वो इस प्रकार है। कुल वाहन जो चेक किए गए हैं वो हैं 12,45,793 और इसमें जो चालान किए गए हैं 2,75,438 गाड़ियों के चालान किए गए हैं। शमन शुल्क करीब 5.25 करोड़ अब तक वसूलने की कार्रवाई की गई है।
So these are the violators who were booked for violating the lockdown conditions, but now these hotspots have been sealed, so you do not go out. The DGP also said that no one from outside will be allowed to enter these areas which have been designated as hotspots.
किसी भी तरह की आवाजाही उस एरिया में उसी प्रकार रोकी जाएगी जिस प्रकार नॉर्मल कर्फ्यू में रोकी जाती है। और सबसे इम्पोर्टेंट चीज कि वहां पर लोगों को चिन्हित किया जाएगा, कौन आदमी कहाँ किस मकान में रह रहा है, वो कितने फासले पर है उन लोगों से जो जहाँ पे पहले इस तरह के लोगों का रहना पता चला है, जहाँ पे वो लोग रहे हैं उनके परिवार के लोग रहे हैं, इससे उसको आइडेंटिफाई किया जाएगा। बैरिकेडिंग करके उन एरियाज को बिल्कुल सेग्रीगेट किया जाएगा, वो जीरो जोन बना दिए जाएंगे ट्रैफिक के लिए।
We are reiterating, do not step out of your homes. If you're living in these hotspot areas, you can be booked by the law. It's a violation of the law, but more importantly, cooperate with the administration. It is in your self-interest that you do not get affected by this virus. So that is why these areas have been sealed. Sealing clearly understands it's a curfew-like situation in these hotspots. Do not panic, take precautions, stay at home, practice health hygiene and sanitation and cooperate with the local administration. Meanwhile, Prime Minister Narendra Modi today interacted with floor leaders of political parties in the parliament via video conferencing. Prime Minister said that the entire world is currently facing the grave challenge of COVID-19. He said that the present situation is an epoch-changing event in the mankind's history and we must evolve to counter its impact. The Prime Minister praised the efforts of the state governments working together with the centre in this fight against the pandemic. The Prime Minister underlined the situation in the country. He said it's akin to social emergency. The country has been forced to take tough decisions and must continue to remain vigilant. The Prime Minister said that several state governments, district administrations and experts have asked for extension of the phase of the lockdown top officials of the government and of Government of India gave detailed presentation on steps being taken to meet the emerging challenges, including the status of distribution of benefits under the Prime Minister's Garib Kalyan Yojana. The leaders thanked the Prime Minister for the meeting and appreciated the timely measures taken by him and said that the entire country is standing united behind him during this crisis. Suggestions were given by some leaders on extending the lockdown in a phased exit after the lockdown ends. And the total number of positive cases, confirmed cases of COVID-19 is 5,194 according to latest reports. Till the evening, they have been reported in the country so far. These figures are till the evening. In the last 1 day, 773 positive cases are reported. So far, 402 people have recovered and been discharged from hospitals, while 149 have lost their lives in the country due to COVID-19. The number of COVID-19 cases are rising in the country. The government's response and preparedness are intensifying. The central and the state governments are taking measures to break the chain of transmission as the cases of COVID-19 are on the rise.
चेन ऑफ ट्रांसमिशन को तोड़ने के लिए बोथ सेंट्रल गवर्नमेंट और राज्य सरकार में सीरीज ऑफ मेजर्स लिए जा रहे हैं। जैसे जैसे देश में केसेस की संख्या बढ़ रही है, उसी के साथ ही हमारा जो रिस्पांस है वो भी उसी से कमेंसरेट रूप में हम बढ़ाते जा रहे हैं। हमारी प्रिपेयर्डनेस भी उसी हिसाब से हम बढ़ाते जा रहे हैं। इस समय में, जैसे इससे पहले भी मैंने आपकी नॉलेज में लाया हूं, इस समय में हमारी गाइडलाइंस के तहत, जैसे कि जो हमारा कंटेनमेंट प्लान है, उसके तहत देशव्यापी हर जिले में कार्य हो रहा है। काफ़ी अधिकारीगण उस एक्शन प्लान के तहत एक्शन ले रहे हैं, इनिशिएटिव लिए जा रहे हैं कि कैसे हम कोविड-19 की सिचुएशन को मैनेज कर सकें।
On hydroxychloroquine availability, Joint Secretary in the Union Health Ministry, Love Agarwal, said that the whole situation is being monitored. There would be no shortage of the medicine. It will be used only on doctor's prescription. It is sufficiently available right now and also for the days to come.
Sir, let me assure you that the whole situation is being monitored at the highest level. In terms of the requirement of the country, linking it with the fact that how much is the production as well as the API availability in the country, it is ensured that not only today, even in future, there will not be any lack of SCQ as and when needed. Let me also again reiterate and highlight, मैं फिर आप लोगों की दृष्टि में लाना चाहूँगा कि हमने SCQ हाइड्रोक्लोरोक्विन के जो प्रिस्क्रिप्शन है एक पर्टिकुलर सेट ऑफ लोगों के लिए रखाई, इनवाइट की है, उसको बताया है आप लोगों को, और इसी के लिए साथ में ये भी कहा है कि इसका जो इस्तेमाल किया जाएगा वो रजिस्टर्ड डॉक्टर की प्रिस्क्रिप्शन पर किया जाएगा। तो काइंडली ये एश्योर करें कि ओनली सेट ऑफ पीपल जिनके लिए हमने बताया है वो ही इसको इस्तेमाल करें, बिकॉज किसी भी दवाई के साइड इफेक्ट्स होते हैं। एंड लेट मी अगेन रीट्रेट एंड अगेन हाईलाइट कि SCQ की सफिशिएंट अवेलेबिलिटी आज भी है और इट विल बी एंश्योर्ड दैट इट विल बी मेड अवेलेबल एज एंड व्हेन वी नीड इट। जितनी क्वांटिटी में चाहिए आज भी कंट्री में सफिशिएंट और आने वाले टाइम के लिए भी सफिशिएंट है।
So as the Joint Secretary said, there is adequate supplies in the country. There's no need to panic. Don't believe rumors. Don't believe fake news that may come to you via various social media. There is adequate supply in the country. But remember, this medicine, hydroxychloroquine, is not to be taken without the doctor's prescription. It is not a medicine which can prevent it. It's a medicine which goes into treatment once you're showing symptoms. But leave that to the doctors. Do not self-medicate. That is very, very important. Do watch this special broadcast because we put out authentic, verified information which would come to you, which would be of use to you and in preventing this crisis. And the government is adopting a two-pronged approach: lockdown and containment measures.
हमारा जो वर्किंग है, जो हमारा थॉट प्रोसेस है, इज ट्विन अप्रोच. वन इज फोकसिंग ऑन लॉकडाउन एंड सोशल डिस्टेंसिंग, सेकंड इज फोकसिंग ऑन कंटेनमेंट मेजर्स. एंड उसी के तहत चाहे आप डे टू डे केसेस की फ्लक्चुएशन देखें, बट इन टर्म्स ऑफ द ओवरऑल राइज इन द केसेस इन दिस कंट्री, वी हैव actually been able to see कि some impact is there. But let me again highlight that same point जो मैं हमेशा कहता हूँ कि जब हम infectious disease से डील कर रहे हैं तो हमारे लिए हर दिन एक बैटल है. हम आज अगर अच्छी सिचुएशन में काम कर रहे हैं और अगर कल हम कहीं एक लेवल पर फेल होते हैं तो वी कम बैक टू द ओल्ड सिचुएशन वंस अगेन. इसीलिए लॉकडाउन के जो रिमेनिंग पीरियड में भी हमने स्टेट गवर्नमेंट से, डिस्ट्रिक्ट एडमिनिस्ट्रेशन से दो चीज़ों पे पैरेलली फोकस करने को कहा है. एक तो टू कंटिन्यू देयर focus on surveillance and contact tracing. दूसरा, increasing the infrastructure for hospitals. और जैसे मैं आपको इससे पहले बता चुका हूं, अब हम मेजर फोकस टेम्पररी हॉस्पिटल्स, केयर सेंटर्स बना के कैसे हम फील्ड लेवल पर अपना इंफ्रास्ट्रक्चर इंप्रूव करें, उस पर काम कर रहे हैं.
And the Joint Secretary in the Union Home Ministry, Punya Salila Srivastav, said that action is being taken against those members from the Tablighi Jamaat who assembled in Delhi and then moved on to different places.
गृह मंत्रालय राज्य सरकारों के साथ मिलकर एक मेगा एफर्ट द्वारा उसने 25,500 से ज़्यादा स्थानीय तबलीग जमात कार्यकर्ताओं को और उनसे संपर्क में आए लोगों को पहचान करके उनको क्वारंटाइन कर दिया था. इसके अलावा हरियाणा में जो 5 गांव थे जहां विदेशी तबलीग जमात टीम्स रुकी थी, उनको भी कंटेन करके सील करके कंटेन कर दिया गया था.
Well, Maharashtra tops the list of the country with the highest number of affected, 64 deaths. With 64 deaths, it continues to be a worrying hotspot. It has become the first state in the country to report more than 1,000 coronavirus cases, with the total number of affected people in the state rising to 1,018. These numbers are as of Wednesday evening.
As the number of COVID-19 positive cases in Maharashtra has reached 1,000 mark with a new 150 cases from Maharashtra on Tuesday, Home Minister Anil Deshmukh has said that some of the attendees of a Tablighi event at Nizamuddin, New Delhi have kept their phone on switched-off mode, and that's one of the reasons why the state authority are deeply concerned, because 1/3 of positive cases belong to Tablighis, their primary contacts. So that is basically the reasons why the state authority are deeply concerned and have been making request to the Tablighis to report. Earlier, Health Minister Rajesh Tope and then Mumbai Police Commissioner, and now the Home Minister has also requested them to report back. However, an FIR has already been filed on Tuesday against 150 members, but as of now, no arrest, no detention have been made. So it is expected that police and the other authority will start acting heavily with an iron hand to this particular Jamaat to ensure that the virus could not be spread across the state, as the numbers are already very high. With camera person Bhagyasri, this is Yogesh Kumar Shikal reporting from Maharashtra.
And besides Maharashtra, Madhya Pradesh too has become one of the hotspots for COVID-19. 229 active cases have been reported, while 13 persons have lost their lives due to COVID-19. The Madhya Pradesh Principal Secretary of the Public Health and Family Welfare, the senior-most bureaucrat in the department, has also tested positive for COVID-19. Meanwhile, a strict lockdown has been imposed in Indore and capital Bhopal. The Supreme Court has asked the government not to allow private labs to charge a high amount for testing. A mechanism for reimbursement of test charges from the government can also be created. That's what the court said. The apex court's assertion has come in response to a petition. The petitioner had told the Supreme Court that coronavirus test is expensive and should be provided free. Solicitor General, however, told the court that earlier 118 labs were doing 15,000 tests per day. The government has now involved 47 private laboratory chains. The government has said that the situation is still developing and logistics are still not clear. Situation is evolving by the day. Well, today is Shab-e Barat. It is also known as the night of forgiveness observed by Muslims. It is being observed today. Delhi police has urged people to stay indoors on the occasion of Shab-e Barat in the wake of coronavirus outbreak. Delhi police in its appeal has said that lockdown is in force even on the sacred night of Shab-e Barat and warned that police will take strict action against any violators. Police has also asked for cooperation from religious leaders and RWAs in maintaining the lockdown. And not just in Delhi, if you are around the country, do not go out on Shab-e Barat. And Dr. Omer Ahmed Ilyasi, the Chief Imam of All India Organization of Imams and Mosques, has appealed to the people to stay indoors during Shab-e Barat.
अपने तमाम भारत वासियों को, ख़ास तौर पे अपने मुसलमान भाइयों को, इमामों को एक गुजारिश करना चाहता हूँ कि शब-ए बारात का पर्व कल आने वाला है और इस मौके पर मैं तमाम सबसे अपील कर रहा हूं, गुजारिश कर रहा हूं कि कोई भी जो भारत के अंदर लॉकडाउन और जो भारत के अंदर दफ़ा 144 लगी हुई है उसका पालन करेंगे. सभी लोग घर में रहेंगे और घर में रहकर इबादत करेंगे. हम अपने जितने भी इंसान जो जा चुके हैं उनकी मगफिरत की दुआ करेंगे, जितने कोरोना वायरस से और जितने भी कोई भी बीमारी में मुब्तला है उनके लिए हम दुआएं करेंगे, और हम अपने ख़ास तौर पे अपने देश के लिए दुआ करेंगे। ये दुआ का वक्त है, सिर्फ और सिर्फ घर में रहकर ही इस काम को करेंगे। पुलिस का, प्रशासन का और जो गवर्नमेंट की गाइडलाइंस हैं उसका हम पूरा ख्याल करेंगे। यही हमारी इबादत है, यही हमारा धर्म है जिसे आज हमें निभाना है। जान है तो जहान है।
We at DD India also appeal you to stay inside, pray in your homes. It is not the time to go out. So tonight is Sabha Bharat. Stay at your homes and pray at your homes. Coronavirus pandemic is making the whole world anxious. The circulation of fake news can escalate the panic. Press Information Bureau's fact-check mechanism has busted yet another fake news about messages circulating on social media saying that the government is screening WhatsApp data of people, and it appears in the form of 3 tick marks. The PIB fact-check clarified this by tweeting that the government is doing no such thing and the message is fake, further asking people to be aware of the rumors. And the lockdown in Kerala is being fully followed by the people of the state. Our correspondent Arun Somnath took a stock of the situation in Thiruvananthapuram.
Well, yes, right now we are at Thiruvananthapuram, the capital of Kerala. As you can see, right now the roads are pretty much vacant, which means that people are taking lockdown pretty seriously. Now, only those people who are into some emergency services or who are on public duty, they are the ones who are venturing out. The shops and establishments are basically locked down. It is only the emergency shops that are open, including medical stores and those with emergency food supplies. But apart from that, none of the shops are open. Now, one of the features that is giving a lot of relief to the state government is the fact that during the last 3 days, the number of COVID-19 positive cases has come down drastically. It is less than 10 a day, and that actually shows the success of the lockdown in the state of Kerala. And the number of deaths in Kerala due to COVID is only 2, which means that a lot of effort is going into the health aspect of containing COVID, and the state has been more or less successful in containing that. Now, one feature that even the Honorable Prime Minister has tried to highlight is that of the selfless services of the health workers, the sanitation workers, the policemen, who are to be respected for the contribution. Now, if you can see on my backside, it is basically pretty hot in Trivandrum, the southern tip of India. It is very humid. While the rest of the community and the people are sitting in their homes, the health workers, the sanitation workers, and the policemen are doing their duty. Now, hats off to these people. Thank you to these people who are making this whole effort of lockdown a grand success.
And amidst the total lockdown and curfew imposed in Manipur, the state government is working around the clock to ensure availability of essential commodities to the people, especially the villagers under the local panchayats in the valley areas and autonomous district councils in the hill areas. Speaking to DD News, Dr. Shashi Kumar, the additional director and the spokesperson of the Health Department of Manipur, has said that 2 COVID-19 patients, including a girl undergoing treatment at JNIMS and RIMS, are improving significantly. It may be mentioned that the second male patient under treatment at RIMS is connected with the infamous Nizamuddin religious gathering. Meanwhile, one COVID-19 suspected girl who left China on the 28th of February and reached Manipur through Myanmar has also tested negative.
A girl who left China on the 28th February and reached the state on the 6th April through Myanmar has been detected yesterday by the authority, and she was brought to the testing center at RIMS, Imphal. She was tested late in the evening yesterday, and her result is now available. It is negative. Even though she tests negative, she will still be put under quarantine for the next 14 days.
And that's it in Tracking COVID-19, a wrap on the special broadcast, but news continues here on DD India. You can catch all the latest updates on our social media, mobile and digital platforms as well. Thanks for watching for the moment. See you tomorrow evening with more on COVID-19. Take care, be safe, practice social distancing, stay at home, follow health hygiene, sanitation and hand hygiene. That's most important. Stay safe. Bye-bye for now.